Hello, everybody. My name is Dr. Ryan Bones. My practice is Beyond Bones Chiropractic right here in beautiful Coeur d'Alene, Idaho. I've wanted to be a chiropractor basically my entire life since I was about in junior high. And so chiropractic is a topic that I'm very passionate about. And so I'm going to try to keep this video within a reasonable time frame, but there's a lot to cover. This is a pretty loaded subject, Chiropractic 101. And so I'm going to try to break down just the essentials for you guys for this video because I get asked constantly, Ryan, can you make something that explains what you do or how you do it or what the heck chiropractic even is? Because a lot of my patients, maybe they know that I could potentially help their brother or their friend or their sister or their mom, whatever, but it's kind of hard to explain what it is exactly that I do. So here it is. You asked for it by popular demand, Chiropractic 101. Awesome. So what it is, chiropractic and what it is a loaded question right off the bat. And I say that because there's a lot of different styles of chiropractic. There's a lot of different techniques of chiropractic. But I am going to today speak specifically of the style of chiropractic that I personally practice, which is actually the original type of chiropractic, sometimes referred to as neurological chiropractic or subluxation-based chiropractic, which we'll get to in a minute. And what that means is that my objective as a chiropractor is to help your body function as normally as possible. And when I say normal, I don't mean necessarily your normal or societal normal, but as it is designed to function, which, believe it or not, is incredibly well. Yes, one of the major premises that I want to touch on before we dive into this is that your body is designed to function extremely well. It's designed to heal itself. It's designed to regulate itself. And it coordinates this whole operation through your central nervous system, your brain, and your spinal cord. Your nervous system is basically like the electrical highway of your body. It's how your brain talks to your stomach or your toe, or how your hormones are regulated. Even your immune system is actually regulated by your central nervous system. Why that's relevant to chiropractic is that your spinal cord sits, as the name implies, right inside your spine. So if you have an issue with your spine, it actually directly impacts your central nervous system and its function. Okay, so there's my major premise. And if you want to challenge me on that, I got all kinds of research on it too. So essentially, your brain talks to your body, does so through your spinal cord. Spinal cord is protected by your spine. Now let's get into chiropractic and how it impacts that. So you have 24 movable bones of your spine. You have 7 in your neck, 12 through the middle part of your back, and 5 in your low back, sitting on a sacrum, which is part of your pelvis. Now, these are designed to move with you as you're running, jumping, working, bending, sleeping, sitting, whatever it might be. When they're moving well, they protect your spine and don't interfere with it, because between each and every one of those bones, there are a set of nerves that come out. Where it goes wrong is if some of those bones aren't moving properly, they can actually start to irritate those nerves. Now, it doesn't always have to be the bone pushing directly on the nerve. Sometimes it's as simple as the irritation of that joint can cause essentially like a chemical static, chemical irritation on those nerves. That chemical irritation or static, well, that disrupts the way your brain can talk to your body. That's an issue. If your brain can't talk to your stomach, for example, your stomach doesn't work the way it's supposed to. It might overproduce acid or underproduce acid, ending up with acid reflux. Now, a lot of people, when they hear chiropractic, they think it's cracking backs. Well, not necessarily. In fact, the goal of chiropractic isn't to just move a bone and put it into a place, but rather the goal of specific neurological chiropractic in this instance is to simply make sure that there is no interference on your central nervous system between your brain and your body. Now, that may come with pain. It may not. In fact, pain is only about 10% of the nervous system's function. The other 90% is running your body. We don't necessarily feel a problem with that until it's late. And what we do is we detect areas of your spine that are affecting that interference, and we remove that irritation, that interference, with a specific adjustment to your spine. Now, a lot of people, again, think that's cracking backs or twisting a neck. No. Now, that is the way that some chiropractors make an adjustment to the spine, but not all, not me, in fact, actually. There's no twisting, there's no popping, there's no cracking here at our office. And rather, that pop, that's not an adjustment. I mean, your uncle can pick you up and pop your back. That's actually not making an adjustment to the spine. It's not detecting an area of interference and removing it through a specific adjustment. That's what, in fact, chiropractors are the only doctors in the world who are trained to do that. And that irritation in the spine, it's what we in chiropractic refer to as a vertebral subluxation. It's a long word. You don't have to know it. All that you need to know is that it affects your quality of life. It affects the way your body functions. And my job is to get rid of it for you. So when somebody asks, what is chiropractic? The simple answer is chiropractic is a science. It's a philosophy. It's an art focused around the detection and correction of interference in your nervous system affecting your health. Boom. All right, big answer. So how does it work? Well, it's as simple as that. We could get into the neurology, but for 101, we're going to keep it very, very, very simple in that when bones of the spine aren't moving the way they're supposed to, they irritate those nerves, that affects our health. It can cause pain, it can cause muscle spasm, it can cause general dysfunction, numbness, tingling, headaches. Man, it can cause all kinds of stuff. But it can also cause none of that. And it can just be affecting that communication. Maybe it's affecting your immune system or causing your nervous system to be imbalanced. Chiropractic, those adjustments remove that interference. When the bones of the spine are moving properly, we don't have that interference. We don't have that irritation. Our body functions well. A lot of people say, I don't get chiropractic, or, I don't believe in chiropractic, or I don't understand chiropractic. It's as simple as that. Your brain's designed to talk to your body. If it can't do that, if there's static on that phone line, we don't function well. My job as a chiropractor is to detect areas that's happening, remove that interference so you can function beautifully. Oop, drop my marker. All right, so what can it help? This is also a big question because in order to answer it, you have to kind of zoom back and you have to think about, well, if we're removing interference from the nervous system, what can that impact? Well, what does the nervous system control? Let's ask that question first. Really, the nervous system affects and controls everything. I mean, every single organ in your body, every single tissue, every single cell, hormones, immune cells, it's all under the direct control of the central nervous system. So we're going to kind of do it if A, then B, and if B, then C. If, and really not if, because it's true, in that the nervous system controls and coordinates every function of the body, and chiropractic optimizes the central nervous system and its function, really, chiropractic has an impact on, or can, in theory, have an impact on almost any single function of the body. Now, this is where some people get lost because they hear something like, oh, those darn chiropractors, they say that they could treat diabetes, or those darn chiropractors, they say that they can, treat, I don't know, let's say indigestion. That was a good one. Or, they can treat asthma. No, none of that is true because chiropractic doesn't treat anything. I don't treat asthma. I don't treat diabetes. I don't treat headaches. I don't treat back pain. That's not what I do. What I do is make sure that the spine is not affecting the nervous system. Boom. As simple as that, right? But if the reason that someone is having indigestion, for example, is because there's an interference in that nervous system controls of their stomach acid, and I remove that interference, the body's going to function better. So really the body is treating the indigestion or helping heal that indigestion. All I did was remove the blockage to that function. I hope that makes sense. I know it's kind of abstract, but I promise it works. And so how can we extrapolate that? Let's say high blood pressure. Most people with high blood pressure, I promise that the reason that they have high blood pressure is not because they're innately deficient in high blood pressure medication. right? Like that doesn't make sense. We're not born deficient in statins, and then that's why we have high blood pressure. So when we treat high blood pressure, when medicine treats high blood pressure with a statin, yes, it can reduce the symptom, but are we actually working on that root cause? Now let's look at chiropractic's approach to that. This is just in the what can it help box, right? So if the body is innately designed to regulate its own blood pressure, but somewhere along the line, the spine is irritating the nervous system and impacting and affecting the brain's control of the body's vascular system, we might end up with high blood pressure. We might end up with low blood pressure. It might be the autonomic nervous system, which causes fight or flight or rest and digest. If that's imbalanced, that's all affected by the nervous system. That might cause high blood pressure. And so chiropractic's approach would be, hey, let's remove the interference to the body's innate, inborn, wonderful ability to regulate its own blood pressure. When we do that, if we remove that interference, what happens is that the body actually brings its own blood pressure back to normal limits. Because your blood pressure is supposed to fluctuate with life. If you run up a flight of stairs, for example, your blood pressure needs to increase so that you don't pass out at the top. However, when you get to the top and you're sitting there, it does not need to be spiked up still. It needs to go back and regulate. Where we run into issues with our health is when our body has lost the ability to heal and to adapt to its environment. Chiropractic's job is to help the body adapt to its environment better. So, does chiropractic treat high blood pressure? No. Does chiropractic help the body better regulate its own blood pressure? Yes. And there's research on that. If you have questions about that, email me and I can send you that research. It's phenomenal. Same thing with the indigestion. It's not a deficiency of Prilosec. The body is not regulating itself properly. Chiropractic helps it regulate properly. Let's say it's a migraine. The body's not designed to have migraines. Chiropractic can help the body heal and regulate itself a little bit better. So to come back to this, what can it help? Well, a lot of stuff. In fact, basically anything that is the result of the body not functioning the way it's designed to function. I think the easier question is maybe what can't it help? I've had questions about genetic disorders. Obviously, chiropractic's not going to go in and move genes around and change a genetic disorder. However, chiropractic can help that person adapt to their environment better. It might help with some of that symptom load that they might be expressing. And we just know innately that a body without interference in its nervous system is going to function better than one with it. So while no, chiropractic's not moving genes around, we might be able to help that person live a better quality of life. Another good question is, what about if I've had spine surgery? What if I had a fusion? Absolutely. We're not going to go in necessarily and move those bones that are fused. No. But when we have a surgery in our spine, it affects a lot of the other parts of the spine as well. And so chiropractic, specifically gentle, low force chiropractic, neurological chiropractic, can work around that surgery area and make sure that the rest of the spine is functioning as ideally as possible, because oftentimes when we have surgery in one area, it starts a cascade effect that affects the others as well. We want to stay ahead of that. So absolutely, we can work with people that have had fusions, had spine surgeries, herniated disc, bulges in their discs. There's some things that we need to be very, very, very careful with. For example, if a patient has cancer or has any other kind of red flag conditions, there's things we can do to help that person, but that's one of the reasons that we have a very thorough evaluation, at least here in our office. Your chiropractor should have a thorough evaluation before they touch your spine. I promise. You don't want just somebody going in there and cracking your back. That's why we have an evaluation where we understand your history so that we can know what's going on and how we need to tailor and adapt the care that's going to be specific and best for you. Okay, so what can it help? A lot of stuff. Now, myths and rumors. I want to do this one because there's so many myths and rumors. Before I dive in, I just want to make sure my video is still doing well. Oh, it sure is. Okay. All right. So, myths and rumors of chiropractic. If I don't cover one, I want you guys to email me it because I want to hear some of the things that you guys have heard or maybe felt or thought. I'm just going to list them off on the kind of the top of my head as I go, and I'm going to knock them out. Number one, If you go to a chiropractor, you'll have a stroke and die. Oh, okay. This is probably one of the most common ones that we hear. Maybe. That's not true, actually. There's probably a lot of more common, but this is one of the biggest ones we hear. Um, now, if you look into the research and the statistics on this, um, have there ever been had someone have a stroke as a result of a chiropractic adjustment? Yes. The instance of this is so minuscule that it's hardly even worth talking about. I believe the last research I read is like one in something over 6 million. And so the percentage of this happening is so minuscule, period. Just in all of data. I think I can count on maybe like one or two hands all the number of people that have ever had this happen. However, uh, what we do in our practice with a low force technique is we're taking that 1 in 6 million and we're taking it completely off the table because we're not twisting anybody's neck. Now, in fact, all chiropractors in recent history have been trained in the way to adjust the cervical spine that will not result in this. This is typically something that happened many, many, many decades ago. But the way we're taught in school today is to completely remove the risk of this happening. And now, especially with a low force technique, that's also going to basically completely down to virtually zero, minimize the risk of that happening. It's also another reason that we need to do a thorough evaluation before adjusting somebody, because in our evaluation, for example, we're going to look to red flags for this to happen. We're going to do typically x-rays of your cervical spine, if that's an area that we're going to be checking. And we're going to make sure that there's not degeneration or underlying conditions that might make somebody susceptible to this. So the techniques we use, it doesn't happen. The evaluation that a chiropractor should do before seeing a patient, make sure it's not going to happen. And so virtually strokes from a chiropractic adjustment are almost never heard of. And so if you're worried about that, there's a lot of ways that we can help bring that cervical adjustment up, starting from a very minuscule level and very gentle, small level until you're comfortable with it. Or if you don't want to do it at all, that's something we can modify as well. But if you drove to the office in a car, you were in way greater danger in that car than you are in their office. I promise that. All right, another rumor. Let's see, off the top of my head. Oh, if you start going to a chiropractor, you got to go forever. What? That's like saying if you go to the gym, man, once you start, you got to go forever. That's ridiculous. You don't have to go to the chiropractor forever. Most people find that they want to because they had no idea how good their body could feel until they actually started getting it well taken care of. And they're like, oh my gosh, I never want to go back to the way I felt before because I didn't realize I felt as crappy as I did. Now I feel amazing. Chiropractic it shouldn't be looked at as a therapy where you have a problem, go to chiropractic, fix said problem, leave chiropractic. Really, as a whole, chiropractic is a part of a healthy lifestyle. It's like eating good food or exercising. You go to the dentist regularly to get your teeth checked. You should go to the chiropractor regularly to get your spine checked. The only thing is that you can get new teeth. You cannot get a new spine yet. If you figure that out, let me know. And so you got to take care of the one you have. And that's why, for example, sometimes people come in the office and they're like, why is that chiropractor seeing a baby? Babies don't have back pain. No, that baby didn't. Well, I don't necessarily know that, but we're not treating that baby for back pain. We're not treating that baby at all. All we're doing is we are making sure that baby's nervous system is functioning as optimally as possible so they have the best chance of expressing life beautifully the way they were designed to. And we're staying ahead of issues so they don't end up the broken old farts that come into our office with the crazy degenerated spine that we got to try to work through. Chiropractic works best in a preventative fashion. And now once you do come to a chiropractor, most people love it so much that they want to keep going because they don't want to feel the way they did before. So no, you don't have to keep coming back. Most people just do. All right. Other myths and rumors. Oh man, there's so many. I should have written these down and I could have actually wrote them out on the board. Let's see. Chiropractor. Oh, school. How about that? Like chiropractors aren't real doctors. There's a good one. Let's do that one. Chiropractors aren't real doctors. If I'm not a real doctor, I want my 8 years and hundreds of thousands of dollars of student loan back because we absolutely are real doctors. I have a biological sciences degree from undergrad, University of Nebraska, and then after those 4 years, another 4 years at Parker University in Dallas, Texas, where I got my doctorate in chiropractic. And fun fact, chiropractors actually have more classroom hours than a medical doctor, specifically in anatomy and physiology and radiology, because everything we do focuses on the body. It focuses on the spine, the nervous system. So we have a great amount of neurology, a great amount of anatomy, physiology, because I'm not prescribing medications. Again, that's an outside in approach to fixing a problem. Chiropractic's all about inside out approach. We helping the body function normally, right? Back to number one. And so I'm not prescribing drugs. I don't want to prescribe any drugs. Instead, so I have almost no training in pharmacology. We have some, like enough to know what people are taking. However, that's not my focus. My focus is the body, so that's where we're actually more highly trained than your standard MD. And so we're absolutely real doctors. I got the degree to prove it, and longer than that, more than that, I sat in the classroom for all the hours to make sure that I knew what I was doing. So chiropractors aren't real doctors. We are. What's another one? My dog is sleeping over here in the chair in the sun. I was going to ask her, but if you have a rumor or a myth that you think of, shoot it to Dr. Bones at gobeyondbones.com, and I will absolutely answer any ones that you have. Those are the ones off the top of my head right now. We can always cover more. Maybe I'll do a second video, a part 2 of just specific myths and rumors. How about chiropractic's really expensive? I want to touch on that one too, because I think that's one that a lot of people worry about, or it's looked at as a luxury, or I can't afford to go to the chiropractor. Let me ask you this. Number one, what is the value of your health? I think that's an important question to ask, because if you can't work or you can't play with your family, you can't play with the kids, can't do life, what's that costing you? And so really when you ask cost, you actually need to compare value. Truly, what's the value? What's the value of having your life back? That's what chiropractic does. That's what I do, is I help give people their life back. And that is a highly, highly valuable tool and valuable thing. Now, the other thing is a lot of people think that there's some big upfront cost, that it's, thousands and thousands of dollars. It's not. I'll be very straightforward. We're basically a cash office because we want to keep the relationship between me and you and not have a third party of insurance in trying to coordinate your care or trying to control your care, I should say, because as your doctor, with our evaluation, I'm going to know what we need to do, and I'm not going to have somebody in some faraway land telling me exactly what you need. And so we like to keep the relationship between me and you. It makes it very straightforward, and it helps us care for you in the best way possible. So we're a cash practice. So our initial evaluation is $250. We do that because we spend about an hour with you one-on-one going through every aspect of your health history, of any concerns that you have. We do a lot of technology. We use a lot of technology here in the office to assess for that interference in your nervous system, because you might come in pain, and that's great. We'll take that into account, but that's not the big picture, right? The big picture is where are we having issues in your spine? So we use thermography to identify those areas, surface EMG to measure those areas, so that we can be very specific with our care plan for you. It's very tailored, very personalized, but also it gives us objective measures so that we can see over time, not only are you feeling better, but are you actually functioning better too, because that's the goal, right? The goal isn't just to feel better. That's the tip of the iceberg. We want to get your body functioning well. And so we have a thorough evaluation that we do. That evaluation is $250. If we need to take any x-rays of your spine, some people already have them, so we can just acquire those from a different office, whatever. If we need to take x-rays, we have digital x-ray right here in the practice. Each level that we do is $85. So if we do a cervical series, a couple views, $85. Thoracic, $85. Lumbar, $85. It just depends on where we look. We only look where we need to look based on our evaluation, based on what's going on, how old you are, how many times you've wrecked your car, everything like that. From there, our adjustments that we do, each adjustment is also $85. It's about 15 minutes or so, because that's really all we need to check the spine, make the corrections that we need, let the body heal, come back and recheck it. So for an average plan in our office, let's say somebody comes in with your average conditions, we're going to work on them. Typically, a treatment plan looks like 2 to 3 times a week for 3 to 4 weeks. And then it tapers down from there until most people end up landing on a maintenance or wellness care frequency of every other week to maybe once a month. What we do is, rather than just charging all of that up front or per visit, is typically we make an estimated care plan recommendation, and then we take the total estimated cost of that recommendation and we just split that up over however many months works for you. That way it's more budgetable, it's easier to track, and we can get you the care you need without worrying about a big upfront cost. For most people, that may be somewhere between $150 to $350 a month, something like that. Just depends on kind of where they're at in their care. And so that's not an outrageous cost, especially for the value that we provide. I promise the value we provide far outweighs the cost that we charge. But it helps you get your life back, helps you feel better, function better, do the things you want to do in life without your body holding you back. And so to answer the question, is chiropractic expensive? I don't feel it is. I feel that it is well worth every single penny that people spend here. I wouldn't be able to sleep at night if I didn't feel that way. All right. Hopefully that can answer that. And I kind of also went into kind of what does care plan look like? What does evaluation look like? The adjustments, once we get rocking and rolling with somebody, they're a lot different than what most people think, at least here in our office. We're not Jean-Claude Van Damming you. We're not jumping on you or people's elbowing you or anything like that. Rather, we use drop tables here at Beyond Bones Chiropractic, which means that we have a very specialized table that lifts up and drops away underneath somebody so that we can make very specific corrections that are very light, and we're not twisting, we're not cracking, we're putting minimal input in the spine. Think of it like a minimal effective dose. I can correct that irritation in the spine with a specific adjustment. It doesn't take a lot of force. It just takes skill, knowledge, evaluation. The table helps. So we can make that correction. And that adjustment lasts typically, like I said, about 10, 15 minutes. By the time we check everything, we only adjust what needs to be adjusted. That's another different, I guess, philosophy that we take here versus maybe another office, is that rather than just cracking every bone in your body, that's not good. We don't want to do that. That's an assault on the spine. You should be charged for that. Rather, we want to adjust specifically the areas that are having the problems and let the body heal. Sometimes that might be as minimal as one segment. Some days we might have somebody come in that doesn't need to be adjusted that way today. We just checked everything was holding well from last adjustment, and that's great. That's the goal. That's what we want. Is I don't want to have to fix a bunch of stuff each visit. These visits should get progressively easier and quicker as the body holds on to the changes that we're making. That's one of our goals here in our office, is long-term correction versus just like a one and done or the walk in, crack your back, walk out. That's not what we're about. We're about long-term correction and actually fixing the root cause of the problem. Hopefully that answers questions. I mean, this was a lot of information. I know I kind of go off on some tangents sometimes because I'm super passionate about this. I love chiropractic. I love taking care of people, and I love getting the word out there. So if you found this video valuable, please share it with somebody that you know that you think might benefit from specific neurological chiropractic care. And if they're in North Idaho, we would be honored and love to care for them. And if they're not, you know what, reach out to me and I will help you find somebody in their area that can get them well taken care of. If you have any questions at all, email drbbones@gobeyondbones.com. You can also find us on our website, gobeyondbones.com, or you can go to Instagram at Beyond Bones Chiro, or on Facebook as well. And if you're in the Riverstone area, if you're in North Idaho in Coeur d'Alene, make sure you stop by our Riverstone office and you can say hi to Keela Bear and the rest of the crew. I want to thank you guys for being with me today and sticking with me. I love what I do, and I know that you love what you do in your life, and I want to make sure that you can live your life as optimally as possible, and that is what chiropractic is all about. Until next time, over and out.